Hi, I'm Dr. Mike Milligan. I'm here with Dr. Lon Jones of Plainview, Texas, the developer of the Clear Nasal Spray, and we're going to talk about why xylitol works. Lon, thanks so much for being with us.
Pleasure. Thanks for inviting me.
First, what does xylitol do, and then why does it do that? Why does it work?
Let's go back to what xylitol is.
I think that's the better place to start.
Chemically, it's a sugar alcohol.
Okay.
It looks like sugar. Glucose is the sugar that our body uses mostly.
Right.
And xylitol is a 5-carbon sugar, where glucose is a 6-carbon sugar.
Okay.
Xylose is the 5-carbon sugar that they make xylitol from. Xylose is to the plant kingdom as glucose is to the animal kingdom.
Okay.
Plants make combinations, chains out of xylose that they build into a plant.
Okay.
And they use it. And there are bacteria that can eat plants and that can eat xylitol and xylose.
Okay.
But they're not usually the bacteria that live in animals and humans. So you have a different group of bacteria. The bacteria that eat human beings, that recycle us, and it's in a nice way of saying it, because we believe in recycling. Well, bacteria recycle us, and if they didn't, we'd have a world full of corpses. Not a very good idea.
No.
So bacteria do a good thing.
Okay.
And the bacteria that eat human beings do a good thing, but sometimes they do it too soon.
Right.
So we want to retard that.
Okay.
And one of the best ways of retarding it is to expose your bacteria to xylitol. Now, there's a researcher by the name of Nathan Sharon who worked several years ago, and he looked at how bacteria hold on to the human being.
Okay.
And the bacteria that we know most about is E. coli, the type 1 E. coli. And type 1 E. coli has all these arms everywhere, millions of arms up and down the bacteria. All along these arms there are little pockets called lectins that hold on to things. And what these lectins are conformed to hold on to are mannose molecules. Now there's lots of mannose molecules in the genitourinary tract. Okay. So this E. coli bacteria can hold on to all of these sites and infect this person.
Okay. So
Nathan Sharon had this idea, what if we put mannose in that environment? And he did, and less infections. Okay. Now we know the principle behind that is the principle of cranberry juice. You know, every woman knows that if she has trouble with urinary tract infections, she should drink a lot of cranberry juice. Cranberry juice works in that same way. It fills up all these lectins so that the bacteria can't hold on. If the bacteria can't hold on, they're washed out.
Flushed away.
No problem.
Right.
And so, same principle. Now, xylose and xylitol work on that same principle because xylitol is a 5-carbon sugar, but it's open. It's open meaning that it can bend and rotate and twist and conform to look like a lot of these sugars that the lectins are conformed to hold on to. It may not be the ideal, but it's enough to confuse the issue. Right. And if you put xylitol in the environment a lot of time, fewer of these bacteria are going to be around to hold on and infect us. Right. And the bacteria in your mouth that cause tooth decay, strep mutans is the major one. Right. That most people are in agreement causes the acid that eats through the teeth. And when you put xylitol in that environment, strep mutans holds on to it, strep mutans is washed away. They're gone. That's a good thing. Yeah, good thing. Prevent tooth decay. The bottom line of the 40 years since they did the first studies looking at xylitol and tooth decay is that 5 exposures of xylitol a day and 80% less tooth decay. Right. So, nice way. Now we're finding out that the bacteria that cause periodontal disease, same thing. They're washed away. So put xylitol in your diet if you want to prevent dental problems.
5 times a day, at least a gram or so?
Well, they talk about that.
Right.
And I don't know. They talk about that. I've used, as we talked earlier, about using xylitol nasally.
Right.
And the nasal application of xylitol is milligrams.
Okay.
So you can use it every hour, 5 times, or every hour for a whole day, and you'll get about a half a plum's worth of xylitol.
Okay.
Not very, very much. But it's enough to wash out these bacteria. Right. So the people who are saying you need 5 grams a day, that's a drug definition.
Okay.
And what I'm thinking is that you need maybe 5 trillion molecules to deal with the 5 billion bacteria.
That's what I was thinking too.
Yeah.
About that many.
Now, how many is 5 trillion molecules? Well, it's milligrams.
Okay.
It's not very, very much.
But 5 times a day.
5 times a day.
Exposed 5 times a day to xylitol.
Often.
You'll reduce your decay.
Yeah.
Significant reduction in decay. Significant reduction in periodontal disease.
Right.
And we all know, therefore, better health in your mouth, better total health for your body. Any last things to say before we close?
Yeah, that's in your mouth. But don't forget to keep your nose clean.
Okay, the developer of clear nasal spray. Don't forget to keep your nose. And
Right.
we've got another video on that.
Right.
Okay. Lon, thank you so much for being with us.
Thank you.
Okay.
Pleasure.